Hi, my name is Andrea Leonard. I'm a 32-year cancer survivor and president and founder of the Cancer Exercise Training Institute. My cancer journey began when I was 15 years old and my mother was first diagnosed with breast cancer. This was a time when I knew absolutely nothing about cancer. She had a modified radical mastectomy, which left her with permanent nerve damage, causing her to spend a summer detoxing at Johns Hopkins after becoming addicted to narcotics to manage the pain. She was also never told to move her shoulder after the surgery and ended up with a frozen shoulder. So she had to go through months of painful physical therapy. And these things could have been avoided had there been education like there is today. 3 years later, I was diagnosed with thyroid cancer. I was getting ready to go to college and they found a lump in my throat and I had a complete thyroidectomy. And this is what really molded me as a person and a professional. I went to University of Maryland, graduated, and then decided to become a personal trainer. So I got certified by the American Council on Exercise, American College of Sports Medicine, National Academy of Sports Medicine, and the Cooper Institute. I'm also a corrective exercise specialist through the National Academy of Sports Medicine and have been a continuing education provider for these organizations for many years. In addition, my entire family seems to have been plagued with cancer, starting with my mom's second diagnosis of breast cancer, which was approximately 20 years ago. And it was at this time that she asked me to help her in recovery so she wouldn't have to go through the pain and agony that she went through the first time. I was a pretty new personal trainer. I'd been training for about 5 years, and I was the director of personal training at the National Capital YMCA. I had been training her breast surgeon, Catherine Alley, and I said, what do you think about writing a book on exercises for breast cancer survivors? And of course, this was a time where there was nothing. There was no internet. I barely knew how to use a computer. And she said, that would be an amazing idea. There's nothing out there. This would be an incredibly valuable resource. So I worked with her, Ted Sangaris, who was the chief of breast surgery at Georgetown at the time, and Shauna Willey, who was at George Washington University, along with a group of other professionals. And we spent 3 years writing essential exercises for breast cancer survivors, which to this day is the only comprehensive manual written directly to cancer patients that takes them through a progressive resistance program. And this has been kind of the Bible for breast cancer patients and survivors. Realizing that there was a much greater need, it eventually developed into the Cancer Exercise Training Institute, where we cover all different types of cancers and surgeries and treatments and everything there is to know about cancer and recovery through exercise. So after my mother's second modified radical mastectomy, she decided to undergo reconstruction. She had not done that the first time. So she decided to do an abdominal tram where they actually took her rectus abdominis, tunneled it up through her torso to create a breast in the original site. They wanted to use her own tissue because of the nerve damage, and then they put an implant on the other side. They did not leave a large enough skin flap. The tissue was pulled way too thin, and as a result, she got continual staph infections over the course of 10 years, which led her to eventually get that removed as well. As you can imagine, psychologically as well as physiologically, it had a huge impact and continues to this day. And this is what motivated me to help other women like her to not have to go through some of these debilitating issues that are completely preventable. Additionally, my father was diagnosed with prostate cancer and bladder cancer, and then he had what was called myelodysplastic disorder, which was a pre-acute myeloid leukemia, and he unfortunately passed away a year ago. All three of his brothers had prostate cancer, and one of them also had pancreatic cancer. Two of his sisters had breast cancer. One of their daughters and one of their granddaughters had breast cancer. My cousins had brain cancer, non-Hodgkin's lymphoma, cervical cancer, pancreatic cancer. Both of my grandfathers died of lung cancer. One of my grandmothers died of stomach cancer. And currently, my mother's brother has aggressive prostate cancer. So as you can see, I'm very passionate about helping cancer patients because I believe that exercise not only helps them to recover to where they were before they had cancer, possibly even better than they ever were, but also it can prevent future incidences of cancer, among many other things. So let's talk about what is the role of a cancer exercise specialist. For starters, we want to improve overall strength and flexibility. Especially since we're dealing with a lot of baby boomers, many of them have never exercised a day in their life. And this is a time we can actually introduce activity into their life and help them to reach new heights in strength, flexibility, and overall endurance. We can also correct muscle imbalances. And to give you an example, following a mastectomy, there is tightening of the chest. There can be scar tissue, adhesions. In addition, there can be damage from the radiation, which will actually cause the shoulders to round in or protract.